right, so we're ready. Thank you everybody for being here, for participating with these meetings. I really do appreciate. I got a few things to say first. The first one is to express our gratitude to Stephen Byron and the Smart Best to provide the food today, the snacks, the food.
Thank you.
So Smart Best is one of our companies that cooperate with us that provide the best. I don't know if anybody has seen the information or have participated with their meetings as well.
Yes.
Okay, so the snacks are the gratitude. Okay, they are very participating in every meeting pretty much all the time. They're active members of the groups. My second is to the NCH, gratitude to NCH and to all the staff members that give us all the support, all the care that they do for all of us that we need it. That's always for us very important for all of us to have the staff members that take care of us. Our third is to Rescue Some Values, which is the one that provide all the support. Rescue Some Values is the one who owns basically the Naples Pulmonary Rehab. Rescue Some Values is a non-profit organization, and everything that goes through the Naples Pulmonary Rehab Club goes through Rescue Some Values, which is the non-profit organization. So that's the parent of the company. So if anybody makes a donation or anything and sees Rescue Some Values, now you know why it goes through Rescue Some Values, because it's a non-profit organization. My last one is to all of you. Thank you for being here. Thank you for participating on these meetings, to be active members of this club. Or we call it club because we live in Naples. Naples, it's of course, if we call it just a group support, people are gonna say, another group support. No, it's a club, and we are part of a special club. We already paid our dues with what we have.
Right.
We are all in this together, okay? So thank you to all of you for your participation, for your active participation, for your support every month and every time that we have these meetings. My last thank you and gratitude is for my number one support. He left, my supporter. My grandson, he was here. He has been my number one supporter on the social media. Okay, he's been smashing the likes all the time to all the videos, sharing my videos. So I love every time that he does that. To my family, that every time I do the flyers, my kids, they all help and putting everything together that I bring for the meetings. So to them as well. The last one is to Laura Falt, which is our host today. She has been an active participant with the Naples Pulmonary Rehab Club. Now we have the pleasure to have her here today with this meeting. She's going to give us a good meeting today that we're all going to need. So, Laura, take it over. Thank you so much.
And I want to thank Oscar and Katie and the team here for, bringing me in. So just to let you know, my background a little bit. I moved here from Connecticut about 2 years ago. When I was in Connecticut, I worked in skilled nursing for almost 20 years. And we had a lot of pulmonary rehab in our skilled nursing communities. I got to work with a lot of the pulmonologists, and our respiratory therapist in one of our communities started a Better Breathers Support Club, which is through the American Lung Association. Then I did another meeting and started doing my own groups in another community in Connecticut. Always loved it. I have a reason for it. I have family members with pulmonary disease, so it's always been a passion of mine. And so when I moved here and had the opportunity, and I will tell you, this club is amazing. The amount of people and support that's offered here between Katie and the team and Oscar and the work he's done is just truly wonderful. And so today I'm going to talk a little bit about staying active while living with lung disease. I will tell you the American Lung Association, this is their PowerPoint deck. I edit some of it, but since all of you have been involved either as a caregiver and or a patient with the pulmonary rehab, you'll notice there's a lot of things that encourage pulmonary rehab. So you all know that, which is great because that is such an important piece. So thank you again for having me, and we'll start with just to let you know that again, we're just going to be talking about staying active and safe. Anything I say here is just for education and information. I will always say I am not a clinician. I have a background in marketing and sales, and so always want to talk to Katie or your providers regarding any changes that you're doing, because this is just for information only. So some of the objectives for today are understanding about staying active and the importance of it for your overall well-being, and making sure that you can find safe and practical ways living with lung disease. I'm also including some information about fall prevention, because that is something that is so important in order to keep you safe at home as opposed to in the hospital, because other things can kind of come of that with other illnesses and injuries. Recognizing and monitoring your breathing, talking with your healthcare provider about what's important. I think a lot of you have already done that because you have Katie here. And then exploring ways to build on your daily life activities and to adapt as your as things change for you. And I think that's important. So overview of physical activities. I think part of what this slide is really saying is that whether you're working, whether you're gardening, whether you're doing household chores, that's all activity. And my mother-in-law has pulmonary fibrosis and pulmonary hypertension, and she allows me to mention that, but I don't use her name, but she does. And the fact that she's been aging with it, with pulmonary fibrosis, and being independent to do as much as she can. It might be laundry and it might be vacuuming, but that's so important. And so whether you're here doing pulmonary rehab, gardening, going out to the driving range, whatever it may be, all that movement is so important. So overview of physical activity, as I mentioned, a lot of it is because between strength and conditioning. Muscles are in your chest and around your lungs, so keeping them strong is so important for your breathing. It's also obviously for your heart, increases your energy and your activity tolerance. And as everybody knows, when you exercise, you tend to sleep better, and it can also reduce your stress and anxiety. I find that the biggest piece to me is to be able to prevent the deconditioning that can happen by not moving. And that's so important. And that's why you'll find that when folks go to the hospital, when they're in the hospital, they'll decondition. You might go to rehab, you'll get therapy, and then you'll be discharged. You might come to home health. I actually do work in home health now currently, after a hospitalization and getting more physical therapy before you go to outpatient for pulmonary. But the deconditioning that can happen can go quickly when you're in the hospital. So I am going to play this if it works, because although let's see, if not, it's okay. Let's see if it works. It may not with the connection, and that's okay. Let me go back, because it might. So let's go to this. What it was regarding COPD, and a lot of the American Lung Association's focus is around COPD, asthma, and other pulmonary disease. However, this was just talking a little bit about the importance of, doing some stretching to help with balance, the importance of doing conditioning and aerobic activity, and it was just a nice little minute video that I thought was good, but it won't play, so that's okay. So what's the right amount of activity? I want to make sure I'm not blocking anybody's. No, yeah, I feel like I'm getting my exercise. So it all depends on your symptoms, it depends on your stamina and your medical history. So what might be right for Carol may not be right for Sam, for example, and that's all okay. And adjusting according to how you're feeling is so important. A lot of times we try to push ourselves, but really it's understanding how well you're feeling. And I'm sure Katie will agree to that too. So that is, a lot of it just depends on you and your overall medical history. Start slow and pace yourself. It doesn't matter whether you're, in your 20s with no medical history, 40s with a little bit, or in your 60s and you have some chronic health conditions. It's always smart to start slow and pace yourself. And again, a lot of these slides you're going to see talk to healthcare provider, and pulmonary rehab is a great option. So you all know that because you're here. Oh, perfect. So I think what I want to focus here is that if you're getting any symptoms that are unusual, and a lot of you might have a care plan or an action plan, and it might be part of it, this is all important. If you have a fever, nauseous, chest pain, obviously shortness of breath, or dizziness or weakness, it's really important that you talk to your healthcare provider. Double check, you might be on new medications, which can lead to falls, so I'll get into that in a minute. But it's really important that you kind of are aware of how you're feeling. And I'll give you an example of a situation. There was a patient that was getting dizzy. It was her blood pressure. So normally she had her oxygen, she would walk into the kitchen or she would walk to go upstairs with her oxygen because she had the concentrator in the house. And she was stopping and bending over because she was getting dizzy. It wasn't from her pulmonary disease, it was from her blood pressure. So just being aware that so many different medical conditions can roll into where you might feel more short of breath, for example. Medications and supplemental action. I think you all know this because a lot of you might be on medications like inhalers. You have your long acting that you use every day. You have your rescue inhalers and the importance of that. And then of course, using that, your oxygen is prescribed if you're on oxygen when you're exercising, but also being aware that when you are exercising, if you have a rescue inhaler, to be using it accordingly based on what you're doing. And adjusting your flow rate, because I know a lot of times flow rates for oxygen will get adjusted based on if you're doing activity, whether you're sleeping or whether you're sitting and watching TV, for example. So what types of activities are best for people living with lung disease? And this was a little bit in the video. So really it focuses on gentle aerobic activity. I know many of you here when I've come in, you're doing quite a bit of activity actually, which is amazing and it's great. Strength training and stretch and chair-based activities can also be good. And I say this because let's say you had an orthopedic issue and you went in for surgery and you were more limited. You could still do your exercises in a chair. I actually tap dance and I've done chair tap at some of the senior living communities because you can do that. And whether it be even chair yoga, they have chair everything now. And so if you ever needed to kind of roll back, you can do that. And I like this because I think it's so true. The best activity is one that feels good. You do want to push yourself, but you want to be comfortable. So let's say some people may like walking. Other people may like riding a bike. Whatever you're comfortable doing and it gets you moving is great. I am not a bike rider. I don't know how they ride these bikes on these streets here either. That to me is life threatening right there. Activity's best for people living with lung disease. We just kind of talked about this, but I think what I like about this is that swimming is another good one too. But the gardening, a lot of times we don't realize, and if you're tracking your steps or you're really looking at, the activity levels, when you garden, you could be doing a lot of work. You could be bending, lifting, moving. And if you enjoy it, that's even better. I always like to garden. I like to get my hands dirty. And then strength training, lifting weights, Pilates, yoga, and the resistance bands. I always wonder, and I'm not like an exercise. I am not an exercise specialist by any stretch. But I always wondered on how those resistance bands were really beneficial, but they are. Because whenever you're strengthening your muscles, that's always important. So I just am going to throw this out. I know you all come here. What are some activities that you like to do when you're not like at pulmonary rehab? Anybody have anything? The outdoors?
Yard work.
Yard work. Yeah. Walking. Okay. I'm going to talk a little bit more about walking because where the fall risk can come in. So I'll talk a little bit about that. Okay. Here it is. What do you know? This is my little piece that I added on fall prevention. So falls are common, falls are serious. So this is interesting to me that 1 in 3 older adults fall each year. Less than half tell their physician or their provider. And I remember this because they didn't get hurt, but it's really important that you share, even if you didn't. I remember one time I asked my mom, I'm like, Mom, I didn't know you fell helping Dad. Oh, I didn't fall. I said, Mom, you fell. She goes, I didn't fall. And I said, why? I'm pushing her, right? I got up. I did not fall. So I said, oh, that's interesting. But when you fall once, you double your chance of falling again. And there's reasons for that. And so I'll talk about that in a sec. But 1 in 10 falls result in injury. 3 million ER visits a year are due to falls. 1 million hospitalizations. And that's where if you have chronic medical conditions, such as whether it be COPD, CHF, diabetes, whatever it might be, that hospitalization can lead to the deconditioning. And then in 2019, 83% of hip fractures were the result of a fall, which is no surprise because hip fractures are big. My mom fell. She had a very, very minor pelvic fracture. That was the issue. What was her issue? She actually broke her wrist. So she was on oxygen, but it was using her walker and getting up and moving because of the walker that she needed. So, and falls are the most common form of traumatic brain injury. So, and it doesn't matter your age. People have osteoporosis. They're at risk of falling. And, there's so many factors that can contribute to it. So muscle weakness, so this is why being at pulmonary rehab and exercising is so important because you want to stay as strong as possible because that's one thing that can lead to falls. Balance and gait problems. So you might have balance issues, but you may notice something where your balance is off. Well, you might have gotten a new medication. That could be contributing because of dizziness or just unsteadiness. So I always tell when you get new medications, always look at side effects from medications because everything has a side effect. Vision and hearing loss. Now, vision loss I understand because you can't see very well where you might be going and you might trip. But hearing loss has a lot to do with the inner ear and balance. It goes back to balance. So hearing loss is something, so when you get your annual visits, it's really important to make sure you get your vision and your hearing checked. Chronic medical conditions. So again, it's not just a pulmonary, it could be it could be diabetes, it could be kidney disease, whatever it might be. Multiple health issues can lead to fall risk. And then the medications, as we talked about, not just dizziness, but low blood pressure, because low blood pressure can cause dizziness as well. Environmental hazards, so poor lighting, we all know this, right? Poor lighting. But I always tell people it's so important that you keep a night light, especially when you're getting up to use the bathroom at night. The other reason is that when you're getting up in the middle of the night, you're sleeping, so you're not quite oriented. And there's so many falls that can happen then. And loose rugs, cords, and clutter. And I will say this, that anytime in home health we do a home assessment, the throw rugs are just a hazard. I'm not referring to the big one that you might have in your living room. That's like I'm referring to the kitchen rugs that are loose and they slide. It's almost like you could go sliding on them. But with cords and pulmonary disease, the oxygen cords. So especially if you're using a concentrator at home, I always used to, with my mom, get green cords, because green you can see better than clear. Now they have purple cords. And so look at your house and what you would see easiest if you needed oxygen so that it would contrast to the flooring. Because I know when I go back to see my mother-in-law, I've almost tripped on her cords because I'm not paying attention, clearly. But it's really important. So she has green cords. And so cords, obviously, if you're on oxygen, you need your oxygen, but that is important to just be mindful. Slippery floors and uneven walkways, and this is when I talk about walking outside. You know, I fell just not paying attention because of uneven walkways. You see less of it here in Florida because you don't have the freezing thaws, right? But I had flat boots on. I was crossing a busy street in Atlanta. Thank God I had family with me, and I hit something, and I went boop. And my family's all looking at me. I'm like, is anybody going to help her? But they did. But they were shocked. It can happen. It really can. Lack of grab bars and railings. So I'm going to mention this. One of the pulmonologists that I worked with, Dr. Shore in Connecticut, we were walking down the stairs. And this was like 5 years ago. And I remember saying, why are you not holding on to the handrail? And I said, I don't need to. And he said, everybody needs to hold on to a handrail because that's the biggest risk of falling. That's embedded in me. I listen to him. And anytime I go anywhere, I'm always very mindful, especially the airport, because you got a bag and this, always make sure I can hold, or honestly, I'll take an elevator because I don't want to, you just never know, right? So that is something that's important. And improper footwear, we have a physical therapist that works for our company, and he sees flip-flops, and I think he cringes because it's such a fall risk. But heels, not necessarily heels like this, and it's not because I'm wearing them and I'm trying to make excuses, but it's the heels that can be, but flip-flops and slippers that your foot slides into as opposed to a slipper where your foot is secured in. Those can be really risky for the where you might fall. So now lastly, behavioral factors that are environmental. So rushing to the bathroom, we talked about that. Standing up too quickly when your blood pressure came down. Not using walking aids properly. I think many people do, but it's really important that if you do have a walker and you're gonna be able to sit on it, you lock it before you sit on it, for example. And then we talked a little bit about how a fall can lead to more falls, and here's why. The fear of falling, you do less activity because you're afraid of falling, which then leads to muscle weakness and more at risk for falling. So that's the whole cycle. So if you fall, it's just about letting Katie know or letting your doctor know to make sure you can overcome that fear and be safe so that you can stay healthy and independent. Lastly, staying active, strength and balance training. Falls are preventable. Home safety improvements, just being mindful of what you have in your home. Medication reviews. If you were being discharged from the hospital, for example, and you went to a skilled nursing for rehab, there would be medications. And then you're discharged home. Whenever you go home, usually there's home health involved, but you really want to, our nurse will always do a review of your medication with you. Anytime you have new written medications, just reviewing that, that's so important. Healthy eating habits, hydration. I don't know if, like, I do know this, when people get dizzy or they have headaches, the first thing is, are you dehydrated? Right? Because hydration and eating healthy is so important to keeping you healthy. And just helping you to, stay independent and prevent falls. And then of course, regular checkups at the doctor. Do any of you here use an action plan? Now I know if you have COPD and asthma, they can use action plans. If you have other pulmonary disease, they may not, because especially with IPF, everybody has a different care plan. But understanding when it's important for you to reach out to your physician and let them know of a change, that's usually your yellow zones. And that's when you want to be mindful. Green is good to go. You're feeling like you're doing well. That's how you've been feeling. When you get into the yellow zone, that's where you want to be mindful and either talk to Katie if you're here, call your doctor, talk to the nurse, let them know that you've had some changes. You might be coughing more. You might be dizzy. It could be a variety of things. And then obviously staying active in the green zone is great. When you get to the yellow zone, it's really important that you're mindful that you really want to watch what you're doing, or at least make sure you're under the care of a clinical provider. The red zone is what you want to avoid. And geez, and the red zone is because the red zone usually is a 911 call, and you want to avoid that, right? So addressing it when you're in that stage where you're having changes. So when you see a provider, if you have COPD, asthma, you should be able to get an action plan. I know, Katie, you have action plans that you use here, right?
Yeah, well, we gave them the instructions.
Okay,
And there's a document that we give the first aid,
yeah, like
which
that,
is the action plan.
Yeah.
Follow.
which is great. That's great. So, and if you do have IPF, your doctor will probably tell you, because I know that I've talked to family that has had IPF, and I'm like, when are you supposed to call the doctor? And I always say, don't wait, because it was a situation where her legs were swelling and it was fluid. And so instead of calling and going to the hospital after 2 days to get treatment, she waited 2 weeks. But fortunately, she's doing okay. Monitoring your oxygen levels, I think you all probably are aware of this. And knowing your saturation level and what's important. You sure?
No, I'm just gonna leave.
Oh, no.
My bones.
Sorry. That's okay. You can stay.
Try your own.
You don't have to leave. So, as many of you know, that in order to get oxygen, usually you need to be below 90 or 89 or 88, I'm sorry, for oxygen level. But knowing, because some people, their normal range is different, everybody's normal range will be different. That's really what it comes down to. So, but to get oxygen prescribed, you do need to be below that. Staying active and comfortable. Pursed lip breathing, I know it's up here. Do you all know pursed lip breathing, I bet? Yeah. Okay. So what I love about pursed lip breathing, it's about smelling the roses and blowing out the candles gently. Not, right? Because I remember working with somebody on this and she go, I'm like, no, it's right? What I do, this is actually to me, it's very common, right? But a lot of times when we have a hard time breathing, it's a terrible feeling. Although I personally don't know it, I do know others that it's awful, right? So what happens is you're having a hard time breathing, you panic, it makes your breathing harder. by doing the pursed lip breathing, it can relax you. And so, but making sure that when you breathe in through your nose, and then you go, when you keep your mouth shut, so it's count to 3, and out. I feel relaxed already. So, but it is, I think, a great strategy to have in your bucket, right? Other symptoms. So everybody's body is different. We talked about this. Health can, when it comes to your activity levels. I think a lot of this we've already talked about, so I'm going to just keep moving on. The one thing I will say is that it's so important to know your own self and know any changes and just be aware. For example, we all know it's really hot out there, right? On a day like today, anything indoors, like whether it be at the Y, whether it be here, the senior center, there's so many places where you can enjoy activity.
Medical alert, med flight,
But it's really,
outbound ETA 5 minutes.
okay, so,
Attention, medical alert,
oh, that's interesting.
Mid-flight. outbound ETA 5 minutes.
That was the
Attention,
first,
medical alert, mid flight, outbound ETA 5 minutes.
so this is all on pulmonary rehab, which I'm gonna skip because we all know about pulmonary rehab. Let's go to the next one. Oh, whoops, here we go. Right. There we go. Okay, so benefits of exercising by yourself or with others. As you probably all know, having support can be motivating, but you might also enjoy doing things on your own because then it kind of gives you time to kind of decompress and just be by yourself. Everybody is different. I know there's a lot of walking groups that happen in the area. They do it a lot, even in the assisted living communities I call on, especially early in the day, later in the day during this time of year. But a lot of the activity and shorter activity that you might do throughout the day, like around the house, that all is beneficial, as we've kind of said. So whether it be by yourself or with others. And here, and even grocery shopping, like a lot of people don't realize that can be, going out, walking, all these things kind of playing, cooking, baking, gardening, all that is activity. We talked about that. So maintaining motivation. And I think that what I think is the biggest takeaway is, well, 2 things. Small changes are important. It doesn't matter what you're doing. The goal is small changes can make a difference. And lastly, remember your why. We all have difficult days, right? And sometimes it's remembering like why we're doing what we're doing and why, like when you're getting motivated to come to pulmonary rehab, no offense, Katie, because it's hot out, you're tired, and you don't want to come, right? It's a long day. Having just kind of, sometimes it's about just taking that one foot in front of the other, right, and doing it. Sometimes I don't feel like going to my tap lessons, and I just have to say, just go. I know you're tired, it's Saturday, but just go. And then once you get there, you feel good, right? Mm-hmm. Same idea. Okay. Ways to stay active, we talked about that. All right, this is the key takeaways. There are practical and manageable ways to stay active. Everybody is different. Regular activities, 20 to 30 minutes of activities, 3 to 4 days a week. And again, the variety can make a difference for many people. When air pollution is high, obviously we do the activities inside here, whether it's air pollution or humidity, either will make it make sense. And then always make sure you stay in touch with your healthcare provider if you have any changes that are going on. So with the Lung Association, we do have some great resources. And if, Oscar, you're gonna be sharing this?
Yes.
Okay, so when you get to whatever page slide this is, go to lung.org and you can search it and you can find great resources. As a volunteer with the American Lung Association, I don't get collateral necessarily to hand out, but you can get the collateral, I think, through the website and you can look at it. I'm gonna be talking to somebody at the Lung Association to get certain things to see if they'll give it to me that I can share with the group and with Oscar. And then I just want to say thank you. I hope, the goal for me today was that maybe there's one or two things that you could all take away, because everybody is different, right? And however I can be a resource, I do have some information on the safety at home and fall prevention. If I gave you my card, you can always use me as a resource. And I'm happy to help in any way that I can. Does anybody have any questions?
I have a comment.
Yeah.
My son works in the shoe business, and he said for older people, which many of us are, one of the important factors to remember when you walk is to walk heel to toe. If you don't do that, you tend to shuffle, no matter what shoes you have on, and then you tend to fall more frequently. So concentrate on heel to toe.
And heel to toe, that's a very interesting point, because heel to toe is is how you're supposed to run. So you don't get shin splints. I was always told that. I grew up dancing and I'm toe heel. I'm always on my toes. That's the natural, right? So that's really good. So thank you for sharing that. Heel toe.
Anybody else? Any more questions?
It was just a comment. A little while ago, you showed us a slide that said 3 to 5 days to keep active for pulmonary rehab and so on. We need an advocate here because we were cut, for people who are on maintenance, we were cut to 2 days a week. And for a lot of us, that's an issue because that means 5 days a week we're doing whatever we're supposed to be doing at home, but we're not doing it. But if we're here for 3 days a week, it makes a big difference. Because there were a lot of us that used to be here for 3 days a week,
And now you're only here.
and now they've cut us back.
Is that a Medicare cut?
No, it's because maintenance, Medicare doesn't cover that, so
Okay.
you have to pay that.
Yeah, we pay.
You can come 3 times a week
Or you have to pay
more,
more? Okay.
But you could cut.
yeah.
Nobody ever told us
They
that.
never told us that.
Now,
Never.
when it's high season, probably not, but when it's low season, like now, you can probably do that. That's something new that
We
we're,
never told.
something new we're considering, yeah. If we have a lot of patients, we probably said it's not a good time at this time, 'cause it also depends on the time that you're coming. Maybe later in the day is better sometimes. Because we might be busy in the morning. But you can always ask, if you wanna do that, yeah.
Okay.
We can, we can maybe do something about that.
Another solution that this is just something that came to mind, is for all of you that are down to 2 days a week, for example, you could maybe meet at, do a group activity together at some place, like, I'm gonna just say the Y, or at somewhere else inside where you might be able to do an activity together.
Or maybe, maybe you guys, one of you, have a gym at your community, you can all meet in that gym. Maybe you don't wanna go on your own, but if you guys agree on one day to go to that particular gym, then you can do it there, that extra day. If you have that option.
Anybody else? Got a question?
No, they never told us.
Say that again?
We were told that. We said,
Oh, okay.
Well, I want to share some information for some of the patients that are here that doesn't know me. I've seen some familiar faces that are always participating with us. The reason for this club or this group support is because I am a patient. I'm still a patient. I was a patient for all this time. I had pulmonary fibrosis. 2024, I was granted the pleasure and have a double lung transplant. So having the double lung transplant, it's been a miracle for me and my family. Some of you that walk before we start the meeting saw my kids. So it's been a miracle for me. That not only saved my life, it saved their lives as well. Okay, so that gave me the encouragement to encourage all of you to participate. Participating from these meetings, it helps. Okay, we always get some good knowledge, we always get support together, we always talk about the issues. Something that I want to bring something that was just happening over here. Most people with COPD and pulmonary fibrosis or any interstitial lung disease tend to cough a lot. Don't feel bad about it, okay? It's part of our condition. It's our body telling us we need to spell this, we need to, so don't feel bad about it. Don't feel out of place because most of the people that is on the outside, they don't know how you feel. I was on your shoes. I walked in your shoes with those conditions. Just because you see me right now, kind of like, oh, he's doing really well. He doesn't look like have anything. I do. I still have a lot of issues after the lung transplant. You still have a lot of issues that you need to cope with and need to live with that for the rest of your life. But it's a better quality of life. And again, for the people that don't have the option of the total lung transplant, there is some other options out there. There is clinical trials that are doing really well. Okay, so there is one clinic now. We have the fortune to have a clinic now with Dr. Sanchez. That was last month. She did a presentation for us. She have a clinic for clinical trials. If anybody needs their contact, by all means, you all will be receiving this information on your email. You all will be receiving an email from me, and I can send you all the information that you need from Dr. Sanchez and the clinical trials. If you don't have the option for the lung transplant. Other than that, I want to say, Laura, thank you so much. It was a great presentation.
Everybody, I try to come monthly, so I can support and see the speakers, and grateful to Oscar and Katie and everybody here, so thank you.
And thank you so much for participating with all these meetings. Thank you. Okay.
Okay.